All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have Dr. Jennifer Landy here to share her expertise with us today. Welcome to the podcast.
Thank you for having me.
Yeah, I'm excited to hear a little bit about who you are and what you do. So why don't you share that with us?
So, my name is Jennifer Landy. I'm an oculoplastic surgeon. So, I specialize in surgery mostly of the eyelids, upper and lower, the tear ducts, and the orbits.
It's very unique, like specialty. You must have gone through a lot of training for that. Can you walk me through like what levels you needed to do?
Sure. So I actually started off in general surgery and I did a year of that. And then I transferred to ophthalmology. So I did an ophthalmology residency and then I did a oculoplastic fellowship after that.
I knew it had to be a lot of years when you're dealing with the eyes. You want to be very careful and well trained, right?
Correct, correct.
Yeah.
Everybody wants their vision to be intact.
Yeah. So what we're going to talk about eyelid surgery today. So what exactly is eyelid surgery and what are the most common reasons that patients come to you for it?
So I think there's kind of a misperception out there that all eyelid surgery is the same, and it's not. There's three main things that a patient presents with that indicates that they may need eyelid surgery. The first is a brow ptosis, which means a droopy brow that could be impairing their vision or aesthetically unpleasing. The second is excess skin weighing over the lashes or the eyelid, and that will cause a heavy, tired feeling. And the third is an actual droopy eyelid itself. So there are three different things. And when you get to a certain age, most of my patients present with all three of them. That doesn't mean all three of them need to be addressed or fixed, but I always go over what the patient has and what the best course of action would be.
As always, very educational for me because I don't think I was aware of the three different topics either. Go ahead. Sorry.
Most patients present to me with complaints of their eyelids feel heavy and tired. They feel like their eyes want to close. They have difficulty reading because they feel like they have to lift their eyelids up to keep them open. And a big complaint is that their peripheral vision is being cut off. And when they're driving, they feel like they actually need to turn their heads to change lanes because they can't see out of their peripheral vision.
Mhm. Do you think sometimes they end up like to ophthalmology to get eye testing sometimes until they get, properly diagnosed?
That's a great question because I think a lot of the population does not even know what eyelid surgery is and doesn't know that it could be the cause of their decrease in vision. And when I say decrease in vision, I don't necessarily mean decrease in vision reading a chart or reading small letters while you're reading a book. Their overall peripheral vision, how much light they're getting in, is decreased when they have a droopy eyelid or droopy brow type of situation. So they perceive it as their vision is poor, but a lot of times it can be caused by the eyelids, not their actual vision. I have a lot of patients come to me and they said, my doctor said my glasses haven't changed in the last year. My prescription's the same, but I feel like my vision is very much decreased. And they think it's due to my eyelids. And then we'll do an eyelid evaluation.
And why, I mean, it might just be structural, mechanical, but why the peripheral vision affected the most?
Because when there's an overhang of skin, it's almost like a hooding effect. And then people get a brow ptosis, and it's almost like it's in a slanting position where their brows tend to droop laterally first or initially, and then you get a lot of hooding over the peripheral aspect of your eyelids, and that's the main cause.
So it just happens mostly laterally first, which is going to affect them sooner.
Correct. Or that's where they notice it the most.
Right. Yeah. Yeah. So how do you know if someone's a good candidate for eyelid surgery?
So when they present to me, we go over what their complaints are. And If they have the typical complaints, then we do a full eyelid evaluation. And I have certain measurements I take. I document if they have brow ptosis or too much skin hanging over their eyelids or a droopy eyelid. And then what we do is every insurance company requires that we get certain testing to prove to them that their eyelids are blocking their vision. We go ahead and get that testing, and then we submit it to their insurance company, and we wait for their approval. You know, the patients often say to me, "Am I a good candidate?" And I'll say to them, "Well, there is definitely a surgery I can do on you. However, whether you're a good candidate or not mostly depends on how bothered you are by the droopiness of the eyelids. Is it causing you impairment or difficulty with your activities of daily living?" And that's the biggest question. And really, the quick and dirty test is if a patient's unsure, I tell them to go home, and while they're reading or watching television or driving, doing any of their normal activities of daily living, lift up your eyelids like this. It's that simple. Lift it up, and if it makes an improvement, then you'll do well with surgery. If it makes no improvement, then you probably want to wait a little bit longer.
Mm-hmm. You already alluded to this a little bit, but so is it considered medically necessary versus cosmetic? And you mentioned the insurance, so is it ever covered by insurance?
The majority of my patients are through insurance.
Mm-hmm.
That's mostly my population. However, they have to meet certain criteria, and every insurance company is different. So I never tell a patient this is, going to be covered or not covered. We wait to get all the correct documentation and the testing, and then we submit it to the insurance company. There are some patients that are not quite ready for eyelid surgery. They don't meet the criteria, and we tell them to come back in 6 months to a year as the situation never improves on their own. As we continue to age, things continue to get more lax, and they will get droopier as time goes on. So if they don't meet criteria at that point, then we'll have them follow back up.
Mm-hmm. So, well, one, what are the criteria, and kind of can you walk us through the process of basically seeing you for the first time, and then maybe how the surgery process goes, and from like prep to recovery?
Sure. So the criteria are a little bit different for every insurance company.
Yeah.
And I'm not going to bore you with all the measurements I have to take and the details. However, their eyelid has to be a certain distance from their pupillary margin when you shine a light on their eye. They have to typically have hooding of the skin that's touching their lashes. They have to meet certain criteria on what we call a visual field test, where the general premise is they look in a machine and they're pressing buttons. When they're in their droopy position, they technically should not be seeing a lot of lights. When we tape up their eyelids, simulating what the surgery would do, they should see a lot more lights. And that's what the insurance company wants to see. So that's the very general type of criteria the insurance company are looking for. I think it goes a little bit beyond that, but that's the short version of it.
Yeah.
When a patient comes in to see me, I ask them what brings them in. I like to hear their complaints and make sure their complaints consistent with what a droopy eyelid would do. Sometimes I have unusual complaints where an ophthalmologist has felt it was due to the eyelids, but it's not a typical complaint. So I like to hear their complaints. I like to see if it's consistent with the amount of droopiness they have. And then after I've done my exam, I explain to them what surgery I would recommend for them. I explain how I would do it. I explain that it's an outpatient surgery done at a surgery center. The average surgery takes anywhere between 20 and 30 minutes to do both eyelids. Most of the time, they're under a MAC anesthesia, which is just a light sedation, and they wake up and they feel good and they go home. I do explain to them that they will look like they were in a bar fight for about a week or two. They're swollen and bruised for about the first 2 weeks. And really the only restrictions they have afterwards for 2 weeks are that they can't lift anything too heavy. They can't go in a swimming pool for risk of infection, and they can't exercise. So most other things they can do normally afterwards. And then we proceed to get the testing for the insurance, and we submit it to their insurance and wait for their approval.
So you do the surgery and then wait for the approval?
No, we
Oh,
get the
beforehand.
approval first and
Yeah.
then put them on my surgery schedule.
So do they require like a pre-operative visit with their primary to get this kind of procedure?
Great question. We do get medical clearance on every patient. So we make sure with their primary or their cardiologist or their pulmonologist that they are optimized to undergo anesthesia and that they can stop their blood thinners. Certain blood thinners need to be stopped for a certain amount of time. And yes, we do that on every patient.
Mhm. Well, you mentioned it was like a 2 week that you're going to look like you're in a bar fight, right?
Yes.
What other things can they expect from the recovery process, or is there any side effects that they should be aware of?
So I think the main side effects of eyelid surgery are, I always tell patients, when I lift up your eyelids, your eyes are going to be more open. The biggest things you can expect are that your eyes might get more dry. And a lot of patients have dry eyes to begin with. So I tell them that it can get worse. I tell them that they might be more light sensitive. So a lot of them are already light sensitive from possibly having cataract surgery in the past, or they're just naturally light sensitive, and that can be exacerbated. Sometimes their vision can change post-operatively, so I warn them about that and ask them not to get a new prescription before they do this procedure. But those are the three big things. So in terms of healing, I tell patients full healing is 6 months to a year. That's mostly for the scar to heal. And since it's in the eyelid crease, and the eyelids have the best blood supply in the body, it typically heals great with no lasting scar. However, I tell them the first 2 weeks is going to be the roughest, not in terms of pain, but just in terms of swelling and bruising, and their vision may be a little bit blurry. So it's your eyes, and you have to consider that. But by 4 to 6 weeks, they're pretty much back to normal. They can wear makeup, they can do all their activities. And at that point, they're pretty much doing great. But I tell them, for them to feel like everything feels 100% normal, it may take 6 months.
Mhm. Are there any risks associated with the procedure?
I mean, there's always a risk of anesthesia. And, the biggest risk we have is really bleeding behind the eye if somebody were to have that. In almost 20 years of doing this, I have never had that. So knock on wood. But, that's the biggest risk. Other than that, dry eyes, light sensitivity, and a slight vision change are really the most common things that they can expect afterwards.
Mhm. So is this just a natural part of aging, or once it's fixed, is it going to come back, or how long do the results last? Like, can you explain a little bit how it happens in the first place?
So the brow droop and the excess skin is a natural progression of aging. We lose elasticity, and unfortunately, everything starts to descend as we get older. When somebody has a droopy eyelid, it's usually a weakening of the muscle. You can be born with that. So we do see congenital ptosis, or the muscle can just weaken over time. I had just operated on a 20-year-old who had droopy eyelids, and the muscle just weakened. So it's not always age related, but the majority of it is age related. As to how long the procedures last, when I remove the skin never grows back. However, as we age, we lose elasticity in our skin. And again, everything starts to descend. So the brow can continue to get droopy, and you can get more of an overhang over the eyelid itself as you age. I tell patients, there's nobody that can tell you how long this procedure is going to last in you, because a lot of it has to do with your genetics, which you have no control over, and your lifestyle. And if you smoke or if you are a sun worshiper, you're going to age a lot quicker, and you're going to need another procedure a lot quicker. This may be your one and only procedure. So it just really depends on the patient.
Okay. Is it more, I guess you see more men or women with this condition?
I would say I see close to an equal number
Okay.
of each. However, I think women come in more proactively, and a lot of the men come in because they say their wives tell them that their eyes look closed all the time. But I see maybe 60% women and 40% men, but it's pretty close.
Mhm. Okay. I wasn't sure if it was like an estrogen deficiency thing that would make it worse or
No,
anything like that. Okay. Yeah.
no.
So what have you ever been referred a patient who had like myasthenia gravis or anything else that can mimic this?
Sure. I have had patients over the years that have had myasthenia, that have had oculopharyngeal muscular dystrophy, CPEO, muscle weakness disorders. And they're kind of put in a category of their own,
Mhm.
but we absolutely can help them. We can lift their eyelids. But what I tell them is they will fall back down based on the nature of their disease. That's not a reason not to lift them if they're disabled by them drooping, because they tend to have some of the droopiest eyelids because of their muscle weakness disorders. But it will fall back down at some point, and we don't know if it will fall back down in a year or it will fall back down in 10 years. Nobody can answer that question, but they know based on their disease that it will.
Mhm. Are there any non-surgical options for people looking to improve the appearance of their eyelids and everything?
So the short answer is no, but the longer answer is there is a drop that's been out on the market for a couple of years that it's not inexpensive and you have to use the rest of your life every day. But in some patients, not all, it can lift the eyelids a millimeter or two, but there is no substitute for removing skin or lifting the brow. That is surgical.
So it's an eye drop?
An eye drop, correct.
Interesting. Okay.
Correct.
Yeah. Are there any like other, I think you kind of already dispelled some myths, but any other myths or misconceptions you hear about eyelid surgery?
I think the biggest thing is that patients come in to me and they think, oh, no big deal, I'm going to have eyelid surgery, I'll be better right away. And I think they don't realize that there's cutting involved, and it's actually a surgery where we're violating the tissues. So they're going to be swollen, they're going to be bruised, their vision may be blurry, and their healing process is not overnight right away. They're back to work the next day, and they're looking like 100%. So I think everybody wants a quick fix, but I try to explain to them this isn't a quick fix. It's going to be a couple weeks before you start looking more normal, because it's a surgery where we're violating those tissues.
Mm-hmm. Or is there any like creams or medications that can help after surgery or beforehand, like for the
So we
eyelids?
talk about scar gels afterwards if they really want to use one. I typically recommend vitamin E cream at their 5-week post-op visit, because the incision heals so well on their own that most patients are going to heal fine without anything. But if they want to use a vitamin E cream, I recommend that. And if they want something stronger, I'll recommend some scar gels. We just have to be careful about which scar gels are around the eye if they get in the eye.
Yeah, definitely don't want to get things in the eye.
Correct. Correct.
So if someone's thinking about doing eyelid surgery but kind of feeling nervous or unsure, what would you tell them?
I would tell them it is 100% normal to be nervous. Everybody's nervous, so that is perfectly normal. If they're thinking about it, come in, have a consult, listen to what they would possibly need, what the process would be for them exactly, because no two patients are the same. Everybody's an individual. And, a consultation never hurts. It doesn't commit them to anything.
You told me you were general surgery first. What was the switch into, I guess, did you say ophtho and then oculoplastics?
Correct.
Okay.
Correct. So I decided general surgery would not lend me any type of civilized life, at least at the program I was at. So I wanted a surgical subspecialty, and I started doing some research in ophthalmology and got very interested in that. So I went that route.
Yeah, I would imagine general surgery is a little bit tougher. Yeah.
It
So
was.
do you have a good work-life balance now?
I do. I have a great work-life balance.
And where are you located?
So I have 3 offices, actually. I have an office in St. Pete, I have an office in Brandon, and I have a cosmetic office where I do Botox and fillers in South Tampa.
And Botox and fillers will not solve this problem, correct?
Botox and fillers will not solve this problem. In younger patients, it may give them a little bit of lift, but in most patients, it does not solve the problem, correct?
So, I mean, does it happen to everybody? Is everybody going to need this surgery?
It happens to aging happens to everybody. The degree to which it happens is variable, and the degree to which it bothers people is very variable. So I have patients that come in looking like me, like you, and they're very bothered by their eyelids. And then I have patients that come in that have slits for eyes because they have so much droopiness and they're not bothered at all. So I never push surgery on somebody that's not bothered by it because I'm not going to help them at all. But it's just a very variable problem, and it just depends to which degree it bothers you, but it will happen to everybody to some degree.
I was trying to make my eyes wider. I don't think I have a problem though. So, well, basically, is there anything else you'd like to share on this topic before I ask you something else?
I would just say if anybody has any concern that this is bothering them, that this is affecting their activities of daily living, a consult is always a great thing. It does not commit you to any surgery, but you can get the information you need and then make the decision on your own.
Are there any other types of physicians that do this procedure, or do they really need to find like oculoplastics?
Plastics is typically the best type of surgeon to do this type of thing, to determine what they need and what can be done. There are certain plastic surgeons that will do it, but they don't quite have necessarily the training that we have, and they don't do certain types of the surgeries that we do. So I would say an oculoplastic surgeon is your best bet.
Okay, well, that's good. That's very helpful information. So where can people find you if they want to learn about your practice or schedule a consult with you?
So I can be reached in Brandon at brandoneyeassociates.com. I can be reached in my office in St. Pete at site360.com, and in Tampa at midtownaesthetics.com.
Nice. Okay, great. Well, we will include all of that in the show notes. And, thank you so much for coming on the podcast today. It was super fun learning all about oculoplastics from you. And
well, thank you for having me. I appreciate the opportunity.
Yeah, so it was a lot of fun. So tune in next week, everybody, for next week's episode. And thank you once again. We'll put everything in the show notes.
Thank you.